I inject the columella area using the cannula at the same holes and inject the lesion area with the needle. And the pillar selection. Everyone knows that the G prime and the flexibility is very famous concept. I don't like to inject the thread in the nose. Doctors generally use the thread with the filler because of the laser pillar are spreaded and the edematous picture. So I always said that please choose the suitable pillar for the nasal area that requires the resistance to the outer compression. So the gel must have the strong G prime status. So if we use the low G prime pillar, the bridge of the nose spreaded and swells and can't hold up at the tip of the nose and also can't hold up at the supra tip of the nasal area. So I always use the strong.
So let me introduce myself one more time. I'm Taek-Kyun Kim from Seoul, Korea, and I'm doing rhinoplasty in Seoul. And first of all, thanks for inviting me, Dr. Huang and Dr. Xiao. And my topic today is about complications related to dread in rhinoplasty. Actually, the rhinoplasty started from the foreign body, as previous doctor introduced us, like a propane, liquid silicone, collagen, anything else. But it can cause the problems, skin problems, like many of them, like a rash, edema, itchiness. So filler material is developed and used, especially nowadays, HA filler is quite commonly used. But still, doing the filler injection only for the rhino, making avatar looking with a repeated procedure. So dread was introduced for the structural maintenance for longer effect of filler with less amount in nose. This article shows the hybrid technique, like a PDO thread with HA filler for the repeated injection of HA filler before, like having the widened nasal bridge, like these two cases. So
and then
many of you
ended by the Dr. Xiao's to remove how to finish how to avoid the complication and how to manage the complication from the filler injection, and then how to build up a new nose. I think this is very balanced. But I would like to invite Dr. Yi to make some comment on the content we present today, and thank your comment. Dr. Yi, are you online now? Okay. Professor Tu, would you like to make some? Dr. Yi, are you coming back?
The news now,
yeah. Could you make some comments on some of the presentation because you're not presenting now at this session?
Okay. Me?
Yeah, it's you. Yeah.
Actually, I recently had a publication about like a thread for the nose sculpting, like a non-surgical rhinoplasty, and I researched a lot in this like combination therapy of PDO threads with this hyaluronic acid. But you know, there are a few papers that does not advocate this combination therapy, not me, and that might be a really useful information while doing HA filler rhinoplasty procedures.
Yes. Yeah. Well, Dr. Xiao, could you please also make some comment on this issue, that how to avoid, or if the practitioner would like to inject? I know you also mentioned how to avoid vascular compromise, right? But how about the widening? Is you ever had any comment on this issue?
Personally, I have less experience in non-surgical approach rhinoplasty, but I have a lot of experience to deal with this kind of complication. So speaking frankly, I don't know the reason that how do they cause this kind of horrifying complication, but I think a lot of paper already mentioned about that. But for me, I think for the thread rhinoplasty, the most important, as Dr. Kim said, you have better not to inject the thread too superficially or too deep, may cause the skin damage and the underlying damage. And you have better not to inject a lot of thread into the nose because cause the following surgeon like me deal with this kind of complication a little bit difficult. Because when we remove the thread may cause a further injury to the structure.
Mm-hmm. Mm-hmm.
Can I have a question for all the speakers?